Vanessa Abrahamson, and I'm one of the researchers on the National Evaluation of Hospice at Home Services in England, called OPAL. This video is about the role of volunteers, including risks, benefits and strategies to build a volunteer workforce in hospice at home services. Volunteers are an essential part of the hospice workforce already. They carry out all sorts of activities, including fundraising, helping out at reception, administration and counselling. However, we found that it was very rare for volunteers to be involved in hospice at home. Most organisations were reticent to use volunteers in hospice at home services due to concerns that volunteers could potentially overstep boundaries, and if anything went wrong, it could negatively affect the hospice's reputation. Despite these concerns, there were many potential benefits of using volunteers in hospice at home services. Firstly, benefits for organisations. We found examples where volunteers had been trained to provide direct care working with hospice at home healthcare assistants, for example when two people were needed to provide personal care. We also found examples of providing indirect support such as respite care, helping with the shopping or collecting medication, and help with advanced care planning. The hospice had invested in recruiting, training and supporting volunteers and embedded them within the hospice at home team. This meant that they provided extra support, boosting capacity, or in other words, it helped the money stretch, addressed staffing shortages and improved hospice at home support for patients and carers. Secondly, using volunteers in hospice at home services had benefits for carers. Informal carers really valued support from volunteers. It gave them the opportunity to go out and have some time to themselves, but they also liked it when volunteers helped with practical tasks like collecting medication. However, some informal carers wanted longer periods of support than was possible, for example just 2 hours per week. They also wanted continuity post-bereavement with someone who knew them and knew their loved one. And these are all things that volunteers could provide. Thirdly, there were benefits for volunteers. They valued building a relationship with patient and carer. Many had relevant expertise, for example a retired nurse or a trained counsellor, while others completed training and went on to become healthcare assistants working in the same hospice, directly boosting the workforce. However, organisations did identify some risk to using volunteers in hospice at home services. These included volunteers potentially overstepping boundaries and going beyond their remit. Organisations were also concerned about managing and retaining volunteers and the considerable resources required to recruit, monitor and support them. Some also thought that volunteers would have a limited role in providing support for patients and families in the last days of life, where the focus is really on healthcare needs. We identified several strategies to building a solid volunteer workforce in hospice at home services. If you as an organisation want to embed volunteers into your hospice at home services, here are some ideas. Ensure you have a good understanding of employment law and that your volunteers are effectively recruited, trained and managed. Ensure volunteers have clear responsibilities, expectations, lines of support and reporting, and that they feel part of the hospice at home team. However, significant resourcing is required to train and manage volunteers to meet the healthcare needs which dominate when the patient is actively dying. Therefore, you may want to limit your volunteer roles to non-clinical activities which are more straightforward and easier to manage. These include befriending, respite care for the carer, practical tasks like shopping, drawing up advanced care plans and bereavement support. You may also want to consider recruitment of volunteers with particular skills, for example nurses or those with counselling experience. Some areas have schemes like compassionate neighbours or compassionate communities external to the hospice. If you have such schemes, consider referring patients and carers early on in your contact with them. We found that there were a number of hospices who had volunteers supporting patients and carers in the community. However, these were separate voluntary teams that rarely created opportunities for volunteers and hospice at home to coordinate their input. At a strategic level, it is important to make sure that volunteering teams and hospice at home have effective and timely lines of communication. The concerns that hospice at home services have around the risks of involving volunteers with people who are at the end of life are important but can be addressed. We've found that some organisations reframe their approach to volunteering, tolerating a different level of risk and allowing volunteers to act more like neighbours with less bureaucracy and procedure. To sum up, volunteers are an untapped resource with huge potential, bridging the gap between hospice and community. They offer the opportunity to address capacity and staffing issues and improve the patient and carer's experience of hospice at home services. Limiting the use of volunteers to non-clinical activities, at least initially, may be more straightforward and easier to instigate. However, volunteers do have the potential to contribute to direct patient care with appropriate training and support. Thank you for watching this video. There are 5 other videos in this series, all based on the findings from our national evaluation of hospice at home services in England. This video aligns most closely with those on sustainability and supporting the carer.